Hi, I'm Dr. Michael Taggart with the Kirkland Thyroid Institute, where we specialize in the treatment and evaluation and successful treatment of chronic thyroid conditions, often which have not responded to traditional medical care. Today I want to talk about secret number 8, and this has to do with what we call anemia. Now, anemia is important in thyroid conditions, but it's actually important in any type of chronic issue. So there's lots of things that we can do for the thyroid patient, but if a thyroid patient has anemia, we're probably not going to get very far. And the reason being is that your red blood cells actually carry oxygen to all your cells. All your cells need oxygen to function. So if we have low red blood cells, which is the definition of anemia, we're not going to be getting oxygen to tissues, and it's going to create fatigue and a lot of other problems. So we really have to address this. So how are we going to determine if you have anemia? Well, we need to do a blood test. And the blood test, we're going to look at low RBCs. And we're going to use, again, we're going to use the functional range, not the pathological range, because it's more sensitive. We'll find things that the laboratory range won't find. And we're also going to do what's called a differential, which will give us different measurements of what's going on with the red blood cells, like are they too big or too small. And so by doing these tests, we'll know how we want to handle things. Now, very simply, if you have anemia, it can be caused by 3 main issues. You might not be producing enough red blood cells, which is usually nutritional deficiency, which we'll talk about in a minute. You also may be destroying the red blood cells too quickly, which would be due to some inflammatory process in the body. Or you also may have an issue where you're actually just losing blood somewhere in your body. It could be in your gastrointestinal tract, or if, as a female, you maybe have like a heavy menstrual flow. Those could be some reasons why you have anemia. So what I want to do is I want to talk about the 2 most common reasons that you would have anemia. We're going to talk first about iron deficiency anemia, and then we'll also talk about B12 deficiency. So in iron cell deficiency, we're going to look at low red blood cells, and also the size of the blood cells would be small. So that's how we know. Now, if a woman has been determined to truly have iron deficiency anemia, we would also look at supplementation. Now, what's interesting is that sometimes a person can take iron, and then after a blood test is redone, there's no change. In fact, I just had a patient came to my office 2 weeks ago. She's been iron for 3 months. The test was redone by the medical doctor. There was not any change at all. And the medical doctor said, well, just keep taking more iron. Well, that's not going to get the job done. So we have to look a little deeper. So if a person's taking iron, they're not getting the iron levels aren't coming up. We've got to look at hydrochloric acid deficiency. You need that to be able to process nutrients and able to actually make red blood cells. You can also have an issue where you don't have enough certain vitamins that you need to actually absorb iron. That also could be an issue. And you also may have parasites. Pinworms are very common, and those will cause you not to be able to raise your iron levels up. So it's hydrochloric acid, pinworms, and then you may have uterine fibroids. Some women don't know they have uterine fibroids, and that can be a reason why your iron levels aren't raising. It's also very important when you check iron levels to check ferritin. That's often not checked, because that's the first sign that you're becoming iron deficient. Now, our second most common is B12 deficiency. On a blood test, we would have low red blood cells again, and we'd have red blood cells that are too big, and that would give us a clue there's B12 deficiency. Now, if you're eating protein, animal protein, especially red meat, you're probably getting enough B12 in your diet as long as you're able to digest it properly. So if you're getting that and you still have issues, then you may actually have an issue called pernicious anemia, which is an autoimmune condition which actually gets in the way of your body absorbing B12. So there's something called intrinsic factor that your stomach makes that helps you absorb B12. B12 is hard to absorb, so you need that intrinsic factor to actually get it into your digestive system and into your bloodstream. So that's something we would look at. Now, if you have autoimmune thyroid, you are actually predisposed to have this, because when you have autoimmune thyroid, it doesn't just attack your thyroid, it can attack other things. It can attack your stomach lining, it can attack your joints, it can attack even brain tissue. So those are some things that are real important to look at as far as anemia goes. And this is definitely one of the things that if you came to our office that we would look at to either rule in or rule out. And if you had it, we would know what to do to help you. So this is just, again, one more piece of the comprehensive evaluation that we would do to find out why you have your chronic thyroid condition and what we can do to get you back on track so that you can overcome it, so that you can start enjoying your life again. So if you're ready to make that commitment, give us a call at 425-821-110 and schedule your first 2 free visits. So I look forward to seeing you next time when we talk about another secret to helping you overcome your thyroid issue.